So today's topic is gas gangrene. So it is a severely, rapidly spreading oedematous myonecrosis seen in severely crushed injuries which are contaminated with a bacteria called Clostridium perfringens. So Clostridium perfringens is a gram-positive obligate anaerobic bacteria which forms subterminal oval bulging spores. So what is the pathogenesis? How can one get infected by this? That is due to some severely muscle crushing injury seen usually in road traffic accidents and fracture of long bones causing impairment of blood supply or bullet wounds. Also sometimes non-traumatic transmission happens from the large intestine where the Clostridium is a commensal to the muscles through hematogenous route. So in the muscles, what happens is it produces toxins alpha and theta. So alpha toxin, it causes aggregation of platelets and neutrophils in the blood vessels and blocks them. Also, it reduces the cardiac output and causes hypotension. Theta toxin activates mediators like prostacyclin and platelet activating mediator, and this also causes hypotension and may lead to shock. So what is the incubation period? It is about 10 hours to 48 hours. If it is more than that, like 2 to 3 days or more than that, it may be some other clostridial species like Clostridium septicum or Clostridium novae. So clinical features. Clinical features are that at first there will be excruciating sudden onset of pain in the infected site. Secondly, there will be crepitus or gas bubble formation in this site. There will be rapidly development of some serosanguinous discharge from the site, and the muscular edema will be seen with skin discoloration. So this gangrenous area will later on liquefy and slough off, and this is followed by shock and multiple organ failures later on. So it is associated with a very high rate of mortality, more than 50%. So what is the lab diagnosis? Lab diagnosis is, first of all, you will have to collect the specimen. That can be necrotic tissue, muscle fragments, or exudates from the deeper parts of the wound. Okay, so after collecting the specimen, we will inoculate it in Robertson's cooked meat broth and transport it immediately to the microbiology lab where it will be processed. So what are the methods of processing? Number one is direct microscopy of the specimen. So there will be absence of neutrophils and some thick stubby gram positive bacilli without the formation of spores. So this is indicative of Clostridium perfringens. If you see some spores, that is some other Clostridial species. Okay, next we will do culture. Culture should be done in anaerobic media like Robertson's cooked meat broth and egg yolk agar and blood agar conventional media in and that is incubated in anaerobic condition like gas pack system or anaxomat. Then thirdly, they will be identified according to their morphology and gram staining properties, but there are some identification reactions. Okay, so the identification points are that they are on blood agar, they will show target hemolysis. They will be Nagler's reaction positive, that is there will be an opalescence around the colonies in an egg yolk agar. They will be reverse CAM test positive. This demonstrates the alpha toxin, and heat tolerance test will be positive. That is, they grow at 45 degrees Celsius. Also in litmus milk, they will show stormy clot reaction due to production of acid and gas. Lastly, what is the treatment? Treatment is early surgical debridement. So all the tissues, necrotic tissues, foreign body are removed, and the wound closure is delayed to about 5 to 6 days so that all the infection wears off. And antibiotics should be given It is a combination of penicillin and clindamycin for 10 to 16 days. Then we can give a hyperbaric oxygen therapy. This will kill the bacteria because it is anaerobic. Okay, so that was all about gas gangrene. So thank you for watching.